Good morning, good afternoon. My name is Jessica. I'm a student physical therapist assistant, and this is my cultural competency presentation. So the purpose of this assignment is to promote the development of cultural competence as a PTA student. So being culturally competent means understanding and respecting differences among people, such as their language, their beliefs, their custom, and their values. So being culturally competent should increase self-awareness about the diversity dimension and how the presence of different barriers to gaining knowledge, attitudes, and skills to enhance service delivery to different patients of different diversities. So the cultural competence continuum shows where a person stands. So the lowest being cultural destructiveness, cultural incapacity, cultural blindness, cultural pre-competence, cultural competence, and cultural proficiency. So cultural competence is not just a single set of skills that one either doesn't have or does have. Instead, it's a dynamic set of attitudes, knowledge, skills, and awareness that shapes our interactions with culturally diverse patients and colleagues. So here's a better view of the continuum of cultural competency, and I like this one because it breaks down each aspect of it. So to the far left, we have cultural disruptiveness, which is basically that dominant group only thinks their rights and their privileges matter. Then to the next one, we have cultural incapacity, which is still stereotyping certain cultures and still thinking that yours is superior. And then we go to cultural blindness, which is you are aware of the differences between cultures, but you ignore them. So this philosophy is treat everyone the same. And then to the right, we're at cultural pre-competence. So this is where you are exploring different issues within a culture and you're committed to learning about those issues. Then we have cultural competence. So this one is you're recognizing a different cultures, how they're different between yours and theirs, and you continue seeking different advice and yes. And then the last one is cultural proficiency. So here now you are implementing changes to improve services based on cultural needs, and you're continually adding to your knowledge of different cultures. So self-reflection, where do I stand? So this was based on the assessment we performed in class. And you see on this chart here, I believe I lie somewhere between cultural blindness and cultural pre-competence on the continuum. I recognize that sometimes I assume that treating everyone the same is fair and equal, but that philosophy aligns with cultural blindness, where the differences among people may be acknowledged but not fully understood or more understood. I do value different cultures, but more so not sure I understand a lot of them. However, I feel like I'm becoming more aware that this approach can overlook the unique experiences and needs of different cultures. So my self-reflection continued. I see myself moving toward cultural pre-competence because I'm beginning to acknowledge the importance of cultural awareness and diversity. I'm actively trying to learn about different perspectives and to challenge my assumptions and adapt my behavior to be more inclusive. While I may not yet have the full skills or competence to consistently demonstrate cultural competence, I'm motivated to continue and improving in this area. So the following slides will be an interview with Ms. Sheetal Singh, who is of a different cultural background than myself. I'm going to utilize the 12 domains of Purnell's model of cultural competence, which is a framework developed to enhance healthcare providers' ability to deliver culturally sensitive care. So, the first domain of Purnell's model is overview and heritage. Wait, no, sorry. Is overview and heritage. So, Sheetal was born in the Fiji Islands and lived there until she was 2 years old with her father, mother, and her older sister. When she was 2 years old, her entire family moved to California for a better life and for better education. They specifically moved to the Bay Area where her dad's brother lived. And Sheetal identifies as South Asian Indian. So this is the first domain continued of overview and heritage. So this domain focused on certain celebrations that are important to the culture. So she talked to me about one called Diwali, which is a festival of lights that marks the new calendar year. So what this entails is prayer, visiting family, and celebrating eating dinner together. A second celebration are weddings. So this entails that it's a family union between both sides. So she had explained that 1 week before the wedding, the bride's father, brothers, uncle, cousins, basically all the males of the bride's side, go to the groom's side and accept the invitation for marriage. And technically, the bride does not go to the groom's side of the family until after the marriage. She also explained that 2 days before the wedding, each the bride and the groom's side has their own celebration, their own party with with a lot of rituals, such as for the females a henna night and lots of jewelry involved, lots of wearing the traditional Indian saris. And the second domain of Purnell's model is communication, and this domain refers to the languages spoken within the culture. Also within this domain are gestures, facial expressions, or forms of touch that have a meaning. So Shito responded that eye contact is really big in their culture, and that whenever they are greeting someone or saying goodbye to someone, they have the prayer hands together. And in addition, within this domain, I asked Sheetal how her culture shows respect when speaking to others. And she responded that males and females aren't very touchy, so there's not very much hugging involved between the opposite sex. And also, when speaking to an older man or woman, you refer to them as aunt or uncle because it's a respect thing. They do not call their elders by their first name. The third domain is family roles and organization. This domain focuses on which members of the family make the major decisions. So in her culture, the men are the major decision makers. However, within her own family, same with her parents made that decision together equally. And in addition, this domain focuses on how a culture cares for their elders. So their whole family cares for the elders. There are no nursing homes, so the family keeps the elder within the family, and people within the family go and visit that elder. In addition to family roles, Sheetal explained to me that her parents were really big on education. That is the reason that they moved here to the United States. They didn't drill her on what career she was supposed to have, but more that she needed an education. The fourth domain of Purnell's model is workforce issues. So this domain focuses on the exceptions of gender within the workplace. So in Fiji, or in that culture, women have a more submissive role, while the men are the breadwinners. In the US, it's similar, but the women also have to work because of the economical differences, but they still come home and perform household duties, such as they come home and cook, clean, make dinner, take care of the children, while the men come home and that was their whole day. They just wait for food to be done from their wife. And in addition, explained to me that the men in her culture, and even other cultures, honestly, believe this submissive role in women. So, in her experience, she said when a male has tried to talk over her, overrule her, take over her classroom, she doesn't allow that to happen. And she sets boundaries immediately. She's very outspoken, and this is different in her culture, and it shows generational changes how she's not that submissive woman like her culture, but how the generation is changing and women being more outspoken. The fifth domain is biocultural ecology. This domain focuses on predisposed health condition specific to a culture. So, her culture is genetically predisposed to having smaller blood vessels, which can lead to heart conditions, can lead to hypertension, as well as diabetes. Domain number 6 is high risk behaviors. So, this domain focuses on how their culture views recreational drug use, alcohol, or smoking. And it also focuses on how safety and physical activity is viewed. So, in her culture, alcohol is the most abused because it is used at parties, social gatherings, and it's seen as normal behavior. And then when talking about physical activity, since Sheetal has become a PTA and works in healthcare, she has shared the knowledge of the importance of health, physical activity, and fitness, and the importance of taking care of yourself to her family. Domain number 7 is nutrition. So, this domain focuses on different foods or spices used within that culture, as well as if they have any fasting or feast traditions, and if there are any foods that they avoid completely. So, in Sheetal's culture, have a carb heavy diet, so lots of rice and roti, which is similar to, she had described it as almost like a tortilla. Um, the spice heavily used is curry. They eat lots of vegetables, lamb, fish, chicken, and they do fast before a prayer. So that morning, they fast the whole morning until the prayer is performed. Then they have a feast after, but only vegetables. They do not consume meat. And her culture does not consume beef or pork due to religious reasons. Domain number 8 is childbirth and pregnancy. This focuses on how a culture views pregnancy and childbirth. So, during when a woman is pregnant and after the baby is born, a prayer is performed with the family. In addition, her culture has big families. So she was telling me about 6 or more siblings. They're really big family oriented culture. Domain number 9 is death rituals. So after death, there is a funeral followed by a cremation. And after the cremation, there's a 13-day prayer where still there is no meat consumed. So the person who died, their family hosts the prayer. However, they are not allowed to cook or clean. Other family members or other people in the community bring food and clean the house for them. And 13 days after that prayer, there's a 13-day prayer following the cremation, and then 6 months after that, they have another prayer, which is same principles. The host family does not cook or clean. Other people bring in the food. And then 1 year after is another prayer. So in terms of grievance, the family grieves together. It's not just friends, it's the whole Indian community that comes together and supports in this hard time. And then the 10th domain is spirituality. So, religion and spirituality are the foundation of their culture, and religion is engraved at a young age. As I was reading a book on the South Indian culture, I learned about that there are stages of the spiritual journey called the karmas of life, which are the spiritual aspects of an individual's life. So, the living faith of Hinduism is expressed through the cycles of karma, marking different stages of life. In addition, her culture believes in reincarnation, the rebirth of a soul in a new body. Domain number 11 is healthcare practices. So her culture believes in Western medicine, including vaccines. And especially what she told being a healthcare worker, she is adamant about her family visiting their primary care provider and performing routine blood works. In addition, her culture also uses very holistic remedies, home remedies, such as boiling hot water with lemon leaves. They use topical gels like Vicks and Tiger Balm, and drinking honey for coughs. And the last domain is number 12, healthcare professionals. This domain focuses on the qualities and preference of a healthcare provider. So Shito responded that the main qualities of a provider is good bedside manner, attentive, and empathetic. It's important that the healthcare professional listens to the patient, not just prescribing meds. And she's seen this in her experience as a PTA. She's seen good healthcare professionals who have good listening skills, good bedside manner, and she's also seen the other end where the healthcare provider is not really present in the patient's plan of care and more so just there to write prescriptions. And in addition to a preference of a healthcare provider, her culture has no preference as long as they're competent, educationally competent. So after learning about Shitol's culture and the way life values her and traditions shape her view, I realized how deeply cultural competence can influence healthcare decisions. So I believe it's positive effects on the healthcare experience. The first one, there is improved trust and communication. So when healthcare providers take the time to learn about a patient's cultural belief, the patients feel seen, heard, and respected. Number two, more personalized and effective care. This helps providers tailor care plans to align with the patient's cultural belief. The third one is reduce anxiety and stress. So patients often feel vulnerable in any doctor's office, any healthcare settings. So when their cultural identity is validated and seen, it becomes less intimidating when a doctor is standing in front of them asking them questions. Number four, better health outcomes. So when there's clear communication, there's less room for misunderstanding, which leads to less room for a misdiagnosis, which equals better healthcare outcomes. So the APTA identifies 7 core values that guide behaviors and decision-making and professional conduct for physical therapists and physical therapist assistant. These values form the foundation of providing high quality and patient-centered care. We have accountability, altruism, compassion and caring, excellence, integrity, professional duty, and social responsibility. So, the 4 core values that I believe define what it means to be a professional in physical therapy are altruism, compassion and caring, integrity, and excellence. So for altruism, this value guides clinicians to prioritize the patient's needs and well-being above their own interests. Compassion and caring, this value guides clinicians to recognize and respond to each patient's unique needs, emotions, and experience. Integrity ensures clinicians act with honesty and transparency, which builds patient trust. And excellence, this value pushes clinicians to research the best available evidence and to ensure patients receive the highest quality of care. So this peer-reviewed article, I found the book that I was talking about on a previous slide called South Indian Hindu Festivals and Tradition. This book allowed me really to deep dive into Sheetal's culture, and it explains spiritual journeys a person entails from birth to death. It also showed a variety of celebrations and observations in the culture as well as the beliefs of their different gods and calendar of festivals. So it really serves as a guide to his Hindu customs and tradition, explaining how everyday practices are rooted in centuries of legend, philosophy, of culture. So it was really neat to deep dive, and that there's an actual book that was available on Google Library. So I was able to read that, which gave me a lot of insight. And these are my references. Thank you for listening.